Well, hello there, and of course, welcome to the Big Q. Today, we are talking about the realization of sexual and reproductive health and rights in Rwanda, but more so, abortion. Where are we as a country? I'll take you through a brief background of where we are and what the country stands when it comes to SRH and, of course, abortion. So the Rwandan government signed and ratified Maputo Protocol by the Presidential Order 1/1 of June 24th of the 2004, with reservations of an Article 14.2.c, which is right to safe abortion. The Maputo Protocol is normally known as the Protocol for the African Charter on Human and People's Protocol on Rights of Women in Africa. It was adopted, of course, by the heads of state in African Union on July 2003 in the city of Maputo. We come back to the country now. Now, Rwanda law criminalizing abortion has not provided any exception from criminal liability until 2012, when the organic law instituting penal code was promulgated. Now, this organic law provided 4 grounds on which a woman would be exempted from criminal liability. Now, under the organic law, a woman was exempted from criminal liability for abortion with court approval when the pregnancy was a result of rape, subjection to forced marriage, incest to second degree, and the endangerment of the unborn baby or that of a pregnant woman. However, in October 2018, the Rwandan government removed this requirement for court approval and the second doctor's permission for a legal abortion. Well, I am not a doctor, but I am joined by a very able guest who will be able to discuss, and give us a brief background of where we are. I'm joined by Chris Sengonga, the head of Human Rights and Litigation at HDI. I'm also joined by Giselle Rugwiro. Of course, she's a woman rights activist. And Dr. Jeanne Wimana, forgive me for not saying Backermans, the founder, director of Flavors Family Planning. Thank you very much for making time to be with us. Chris, I'll start off directly with you. This implementation, of course, from the legal side of it. Give us a brief, because we have read from 2003 when, Rwanda ratified everything in Maputo, and where we are today for us not to actually, as a woman, to not need a court, court order, thank you, for me to probably procure an abortion. Where are we briefly, and this picture, is it bright for us as women today?
Thank you so much, Fiona. I think you've tried to dig deep from the history perspective. I would say so far so good. If you look at how the trend was from 2012, by then women were given rights to access safe abortion. But in law, in legal terms, there is what we call back clause. So they were given rights to go and access safe abortion. But later, when you look at Article 165, the last paragraph was saying that they should have a court order.
Yes.
And because going through court process can take more than 9 months, and the pregnancy cannot wait. So you can imagine what happened in most cases. We had cases where women could get court order when already the baby is playing around. So since then HDI and other organizations championed an advocacy that led to change, and court order was removed, as you previously said. So currently, we have a ministerial order implementing the law that determines offenses and penalties in general. The one you talked about that was promulgated in 2018. So at least we could say that the ministerial order, as it is, gives, I would say, absolute rights to women under certain circumstances that they should go and see a medical doctor to have safe abortion. And we have seen the trend since 2019 in April 8th, when the ministerial order was out. We have seen a shift from how we used to see women accessing safe abortion.
Absolutely.
Yeah, and I would say that at least today we are seeing many cases coming up, and we are seeing women opening up to go and seek the service from medical facilities.
Dr. Jean, as a doctor, how many women would you say in a month, give us a rough picture, would come and actually ask for an abortion? Do we have women who actually have this voice,
Yes.
who, you know, who do not actually fear and say, please help me procure an abortion?
I think an arrest will take abortion as something extraordinary, but it's a complaint.
Okay.
It's a complaint, so women and girls can come to the consultation seeking for abortion services. It's normal. And I would say that, though I don't have specific numbers of how many women and girls in the country that go to the hospital seeking for abortion services, but what I know is that it's a complaint. It's a usual complaint. We receive that in the consultation office, and I think everywhere in the country, like everywhere in the world where abortion services can be provided.
Absolutely. I want to bring in the factor of the religious people right now, because a religious person will tell you, as long as you're pregnant, be it day 1, day 2, this is a life. This is life in you. Is this an argument that you'll agree to? Is it life, day 1, day 2?
I personally stand for the scientific view of life.
Okay.
Here I mentioned when the fetus is viable, it's more than that time. So,
please explain when the fetus is viable, because you have the medical background right now.
all right, so there are a lot of different discussions about it. So some of the people will say the fetus is viable before 22 weeks and 6 days, and as it stands for 21 days.
Okay.
But in our context here, as the law says it,
Yes.
we stop at 22 weeks.
Okay.
So that's what we have in the law. We provide, or abortion services can only be provided if the pregnancy or the gestational age is not beyond 22 weeks. Unless the pregnancy will have a threatening condition or a very bad outcome to the fetus or the mother. So otherwise, we stand for the 22 weeks.
Absolutely. Giselle, I want to, bring you in. I'm sure you've heard what Chris has said, you've heard what Dr. Jean has said, but as a women's activist, I believe there's a saying, a terminology, my body, my choice, my rights, What's your take on the current situation today, as you've had what the government has put there for the women? Are we happy with this? Are you satisfied with this?
No. I mean, first of all, I acknowledge the fact that we're making progress. We've started acknowledging that a safe abortion should be available in cases of incest, rape, forced marriage, and the sort. But I think we could expand a bit more to make that accessible to women who are outside that scope. At the end of the day, I think women should definitely make choices in regards to their body and not have someone else make that choice for them. There's structures that are there legally and whatnot, but I feel like we still have some progress to make, a long way to go. I think we should definitely go back to the root of all of that, how abortion is demonized due to culture. But people need to understand that culture is not static, it evolves with time. And culture should never be put before the well-being of a person. I think that women should have access, first of all, to contraceptives, the information in that regards, without necessarily having to even go to the doctors to have that information, because you have, even in the medical field, service providers that judge you when you're even asking for information. As a woman, you go to a doctor seeking contraceptives and they ask you, are you married? Should that matter? As a person, even with legal age that allows me to have that access, my marital status shouldn't matter. So the mentality of people, the attitude with service providers should change. They should be well trained before they're put in those positions because their take and the information they give out, be it negative or positive, affects the rest of us.
Absolutely. Chris, I want to bring you in terms of law and legalities. You know, like she rightly put, Giselle, doctors out there discriminate. Doctors out there start asking, you know, where's your ring? Do you have a ring on it? You know, should we have a procedure? Should we have a legality, you know, that says, because of course as a doctor, you are supposed to keep the secret, the oath, yes, the confidentiality of it all. But then here we have doctors who discriminate. Should we have a law that actually goes beyond us saying, okay, we don't need a court order, but then we also do not need doctors to push us to the brim, you know, ask for the rings, ask for marriage certificate, that's as far as they can go, you know? What more needs to be done?
I believe if you look at how the ministerial order is designed today, it really gives absolute rights, as I've said previously. And it even talks about confidentiality, that when a woman is seeking safe abortion, when he goes before a doctor should keep that as a secret. But the trend has been, the experience is that sometimes women are subject to unnecessary administrative conditions.
Absolutely.
Which we think they are not written anywhere in the law. The law is clear. And a doctor, his responsibility or her responsibility is to give service. So when a woman is seeking the service and goes to any medical facility, I believe she should get the service. To me, having seen the experience from women who call at our hotline at HDI, I think we need more of an implementation plan, a guidance on how, not how the doctor should do it, because they already know what they should be doing. But at least the cost and the price, how much a woman is supposed to pay for safe abortion services. And at least to extend and say that a woman, when she goes to seek the service, she will go straight maybe to this department. Because if there is an article that talks about confidentiality, and a woman now is subject to unnecessary administrative conditions, sometimes they are stopped at the gate.
Yes.
That where is it transfer? So when she escapes that, then she will go meet a receptionist. Sometimes receptionists are not doctors. So if a woman reveals why she has come to the hospital, then when are we talking about confidentiality? She has already told the two.
I know.
The security man, she goes, tells a receptionist, she will go and tell an accountant. So by the time she reaches a doctor, she has already revealed her secret to more than 2, 3, 4. And then now, the ministerial order, purpose and spirit is not respected.
Absolutely, yes.
To me, I think we need to do more sensitization with doctors and all health care providers who work at hospital level, at least to understand. And a guidance that a woman, when she goes straight to medical facility, she should go direct and see this person for that service. Yeah.
Absolutely. Sex education, how important is this?
Sex education, I think, is really important. It's definitely the basic human right, sex education. That's what I believe personally. But here, let me come as a young person, come as a doctor, but also favors of family planning. So, favors of family planning, I will start by explaining what it is. It is a company that disrupts male engagement in family planning using edutainment skills as we employ the kitchen materials for hands-on simulation to provide holistic information to men and boys about male engagement in family planning. So we are the kitchen show chefs in the favors of family planning, and that's the food we cook. And thanks to the iAccelerator program by Mbuto Foundation and stakeholders for having supported us and boosted us to do that work. But coming back again to the sexual and reproductive health rights, as a young person, I always stand for protection of young people. Here's why young people need protection. Scientifically, I believe that youth age is time for enormous physical, psychological, and social changes. And these changes are either beginning or on the way. Physically, it is time when puberty occurs and attractive parts take off.
Okay.
And psychologically, it is time when cognitive responses are starting to be built. And socially, it is time when the parental influence starts to decline and the influence of guardians starts to decline. And when the influence of others, including peers and others, start to increase. So all of these changes, when you put them together, they determine why young people can have sex. But most of them are not ready to plan for the family yet. So that's why I think sexual, reproductive, and rights education is very important. Number two here, I come back as favors of family planning to the side of male engagement. And male engagement here, I bring that in the previous years, people have been seeing sexual reproductive health education, family planning in terms of women and girls. And I think this is not appropriate personally because I believe there is no pregnancy in this world that is known to ever happen without a man or a boy involvement in the process. I think that's too easy to understand. But also, when a woman or young girl gets pregnant in a period of 9 months, or even more if you add the prepubertal period, she's going to deliver only one time. And this is contrary to a man or young boy who has the ability to impregnate more than 1,000 of women and girls in the very same time frame. Yes. Depending on how sexually active and how energetic he is. So that's why I stand for the protection of young people, but also at male engagement when we talk about sexual and reproductive and rights topics.
But when do you think we need to instill this type of education? Because this has been a debate, in our country. It has been a debate when people say, Umwana, my baby is still a baby. They're 15, they're 16, that can't work. When should we educate the children? Is it by the time they're in class 6? Should be class 5? Should we wait until they go to secondary school? Because like you've said, we have active young men and women out there, who actually have all these types of sexual things. But then, when should we have this education? When should we start teaching our children, say it is okay, this is a condom, this is how it should be worn, my girl, these kind of contraceptives. When should we have this education?
We have the national regulations, there are international regulations. Maybe when we come to the aspect of the national regulations around when we have to teach that, maybe Chris will take us back to the,
the law.
To the law.
Yeah.
But here, I'm going to speak personally. I personally believe that young people and adolescents, they need this information. And, when we are talking about the age, I believe personally, I'm going to speak here personally, I believe that if a young girl can start a menses or menstruation at the age of 13, then she can get pregnant.
Absolutely.
I believe that she needs the information. That time and even before she gets to that period, because she needs to be prepared. She needs to be ready for that period to come, not to be surprised when that process has started.
Absolutely.
I stand for that, but also for the young parents, 16 years old, 15 years old, and I have 2 children or 3 children. There are a lot of challenges around that.
Yeah.
So I think personally that information is needed.
To be passed. Giselle, on the same thing, sex education, as a woman activist, what more should be done, especially for women who have the voice, to amplify it and ensure that our children are taught what is right, what is wrong, trying to break these barriers which we know are there, because we already know we have an issue with teenage pregnancies today. Maybe if we educate them educated them younger, you think this would have been a solution to all this?
Definitely. I think we should first stop shying away on the fact that teenagers are sexually active. A lot of adults who are responsible for these teenagers try to ignore. A lot of parents don't want to think that their kids are sexually active. But if you acknowledge that it's biologically, they will start being curious. You start at home before you even reach at school. You start educating, normalize your kids knowing that being sexually active is actually normal, but they should be safer with it. If you create that relationship with your child and they come to you and give you certain information in regards to their curiosity, you will be able to control how far they can go and how much information they can get, prepare them. And I think those access to contraceptives would help as well. We shouldn't start like saying that those should be available from a legal age, what we consider legal, because they're kids who are sexually active under that age. And if we tackle that problem, actually help them prepare themselves, be safe, we will reduce the number of unwanted pregnancies and in consequence reduce the number of unsafe abortions that are happening in our communities.
The male engagement, how can we push this further? Because, you know, it's mostly the mothers who are left with this. I'm sure we'll all agree. You know, Nungana Wawe, that's your baby, go talk to her, you know. How far can we push to see that we have male engagement in this discussion, that they're comfortable, our father is comfortable to say, my son, this is a condom, that's how it should be worn. Amen.
Yeah, I mean, definitely, like those, we keep focusing on young girls and whatnot, but these boys need to also understand that they need to protect themselves. Men need to engage, not just men, but like parents need to engage with their sons and explain to them the consequences that, like, of what happens when you have unprotected sex. I mean, these same men who are not having these talks are in positions of power where they get to even dictate what the law is, putting certain restrictions. If they acknowledge the fact that these issues are not just for women, but for the general population at hand, then we can move further. It's not just a woman's problem, it's a society.
It is absolutely.
So it involves anyone. These talks, these sex education conversation that we have, whether at school, at home, at these health centers, should always involve men.
Absolutely. Chris, I want to bring you in. You know, we've spoken lots of we're now into contraception, you know. But the law relating to human reproductive health in Rwanda grants every person the right to medical services and information related to human reproductive health. If you're under 18, the law limits your access to reproductive health services. Is it time that we can change this? What does the law stipulate besides what I've read, you know? Because clearly you can say that if you're under 18, the law limits, you know, access to reproductive health unless you have a parent or a guardian to buy you the condom, to buy the contraceptives. I mean...
Yeah, absolutely. I really believe and support that it's time, looking at the increase of teenage pregnancy currently we have from previous 3 years. It's time that we should amend the law. And the process had begun, actually. The process had begun end 2018 and early 2019, where a group of youth and adolescents wrote to the Prime Minister themselves that they need Article 7 of the law you have just stated to change. We tried to engage the Ministry of Health, but I think because of COVID-19 that has almost retarded everything, and but already the process was engaging, and adolescents and youth were hoping at least within 2 years to see that they could have access to contraceptives. And it was really very helpful because they themselves, they are the ones demanding it. So time and again, it wasn't their parents, but they stood up and wrote. So I believe the Prime Minister also engaged the Parliament that, do you think there is a need that this law should be revised? And I believe that the process will continue. And if you remember, there was even a discussion, the national discussion about if we should allow adolescents and youth to access contraceptives. But still, as you're saying, religious, culture, everyone is like, no, no, no. But we've had a chance to meet many of these youth and adolescents. And for them, some are free to talk about those issues. And they tell you frankly that up to the age of 18 or 17, their parents have never talked about sexuality issues with them. And sometimes they, of course, point at parents. We wish we knew these things when we were young. And also, when you look at the calls we normally receive at HDI, most of them you find that the questions they're asking, you find they have not been engaging at an early age. But the discussion was, at which age should we allow them?
Should we allow this? Yes.
Some were of the view that maybe at 12, but 12 is too early. If you look at the ministerial instructions that allows every child at 12 years to go and for HIV testing without a parent. Then some were in that angle, but others were like, no, at 12 years old, someone is still young. Can we push for 15? So what about someone at 14? She's sexually active. If you stop her from accessing contraceptive, you not stop her from engaging into sexual activities. You will see her pregnant. So what next? She's the one who will drop out of school, become a teenage mother, and all consequences now comes back to a girl child.
Let's talk about advocacy, because I believe back in the days, we would go to a pharmacy or you'd go, say, to a club, we'd have those condom dispensers. We used to have those kiosks, I think, somewhere in town, but they somehow come and disappear all of a sudden. I'm bringing this to you because I'm thinking as HDI or maybe other NGOs, flavors as well, why can't you have something and say, male or the young ones, if you're afraid to go here, maybe you can come to our offices and grab a condom or two? I mean, how will we what's our self-initiative in this? Because you are seeing the problem. So what's the answer? Where are we building the bridges to this?
I believe it would be good because us as lawyers, we know the consequences of the law. If the law states that someone below the age of 18 does not really have the capacity to take any decision upon her sexual and reproductive rights. And then we say, okay, if you can't access this from a pharmacy, then we at HDI, we do provide. I believe we are going contrary to the law. That's why we had to engage policymakers first. And if the law now is friendly, then we can be able also to engage other youth centers and tell them this is legal. You can provide contraceptives, you can provide condoms, you can provide any other SRH service without any restriction.
Absolutely. So this is something that you can look into maybe to push for as advocacy. Doctor,
Yes.
Contraception is expensive.
It is.
We've seen people, we've seen articles. Yes. Someone tells you, a pill should probably cost 1,000 or at most 2,000.
Yeah.
Today, a pill by standards like 10, 15, 20,000 Rwandan francs.
Yes.
Who will afford this pill? Surely. And that's why we are decrying. So as a doctor, what efforts need to be put in place? Or what maybe the government, can they, VAT or something, tax exemptions? Do you think this is an answer? Because we cannot be saying contraceptions are in the market, yet they're too expensive for anyone to actually afford it.
True. Yeah, thank you for bringing that. I wish we had economist here or another person who did the management of that. But I think you're right. Contraceptives are very expensive. Some people cannot afford them.
Yeah.
And as Chris started, it still comes back to the legal aspect. So when these policies are changed and the access is very fair. So then people can start thinking of how to put this out and bring in other programs of supporting people to access contraceptives in the most easy way. But at least what I see in the hospital is that they have a pharmacy. Some people can afford some contraceptives at the pharmacy, at the hospital pharmacy. But of course, there is another big number of people that cannot afford the contraceptives. So I put this in the hands of the Ministry of Health and the other authorities who look after this to see what is the appropriate solution to that, together with other NGOs and civil society organizations, because I believe that it is an urgent matter to everyone who cannot afford contraceptives.
Absolutely. Giselle, on contraception and their costs, I mean, what more can we do? What else can we do?
We, obviously, like for me, if it was up to me, they would be free. Because when you look at the socioeconomic status, like in Rwanda, you will find that people, the less privileged, the poor, are the ones who are having a lot of kids that they cannot afford to have. They cannot afford to buy those contraceptives. So make it free for them, because what happens after is a bigger strain financially. It's better to avoid that particular problem. If you make it free, you avoid that issue of abortion altogether. The number of unwanted pregnancies will come down. It's a little, it's discriminatory to think that something that necessary, that a lot of women should have access to, is that expensive. What about the less privileged? I think we definitely have to bring the price down to pretty much free.
Absolutely.
Otherwise, we're limiting a lot of women.
But can we also normalize the issue of carrying a condom? Because, you know, one time we were having a discussion with HDI, and then you're in a room full of, active people, and then you ask, so who has a condom? And everyone's like,
oh, yes.
what are we talking about? I want to go under the chair. Can we not talk about? How can we normalize this, surely? Because it's 2020.
By normalizing that being sexually active is okay. There's a lot of stigma on it. It's looked at as if it's dirty when we know it's happening. It's normal. It happens a lot. People are shy from entering a pharmacy to buy. Even like, imagine, even men are shy. Now imagine women, how they would feel.
That's true.
So it all comes down to educating people and having a good attitude, especially as a service provider. Don't give someone an attitude when they come in to buy those things. Look at them as if, like, you must be doing something wrong, Normalizing it, having a lot access to that information and the sort, I think.
I think that's right. The most important thing that I bring in here when it comes to a condom is accessing information. Like, let everyone get the information. And when we talk about a condom again, you should think of its role. If you know that a condom can prevent an unwanted pregnancy, can prevent sexual transmitted diseases, then why is it so hard to carry a condom or go ahead and look for it?
If you can carry a wallet.
If you can carry a wallet. I think it doesn't even weigh that much than carry a wallet. So there are a lot of things to be done with, again, the culture, the stigma, what the people believe, and to see how we can bring the information to the very local level and let the people access the information, and then when they get to see that a condom, I can go to the market, get a condom, if I'm allowed to, in the a legal aspect. So why not?
Absolutely, why
I
not?
think it's normal. Yeah.
Chris, under Article 125 of the law determining offences, I'm sure you're very conversant with this law and their penalties in general. There's no criminal liability if the pregnant person is a child, if the person having abortion had become pregnant as a result of rape, the person having abortion had become pregnant after being subjected or forced to marriage. The person having abortion had become pregnant as a result of incest or up to the second degree, or when the pregnancy puts at risk the health of a pregnant person or the fetus. I mean, I'm looking at this particular article and I'm thinking, how further can we push? Because I'm coming from a background, say I get pregnant, but I'm not ready to raise my child today. It is not forced, it was consensual sex, but I'm not ready to have a baby. One, maybe the contraceptive was too expensive for me to afford. I was not subjected to any of the underlined things on this Article 25. How are we going to move on with this? Because we are having people who go, back doors to doctors, procuring abortions. Some die on the table. Some become infertile, if I should use that word, at some point and can't have babies anymore. How do we move with this?
I believe it's an issue that we need all of us to push as a society. And issues to do with access to safe abortion has been controversial, not only in Rwanda.
Yes.
And in the morning I was reading in Tunisia, it actually legalized abortion in 1973. Up to today, they are struggling. And for them, it's open. But issues of stigma, culture, still today, even the 5 exceptions we have, we are still dealing with the stigma of healthcare providers who think on behalf of women who have the autonomy and rights over their bodies. We have the society which thinks that when a woman is pregnant, she carries a baby for the community, not the husband and herself. So I believe that it's a journey that we need to go through. If at least the government has allowed for those 5 conditions, we can see the trend and keep educating, sensitizing, and engaging the community. By the time the community at least is aware, have information, I believe we can also push for opening up. And for your information, apart from Tunisia and South Africa, there are countries that have opened for all reasons. You just go, financially I'm not stable, I need this. And they don't even ask. But still, challenges are still there. To me, I have many times and often received the calls of women who call and say, I'm out of this scope. And of course, as a lawyer, I have to say, yeah, this is what the law prescribes, as you've read. I think if you don't fall among what the law states, then for sure, I don't know what I can do. Because that's the law. But other women have been calling, pushing, and whenever we have this discussion, open discussion, some women call and say, why don't you open for even socioeconomic reasons? And we say it's time. If women can come out, come together, go see policymakers, this is what we need. I believe our policymakers really can listen and say, okay, if this is the shift now we need, this is 2020, as we are saying.
Absolutely.
This is what we should be doing. And I think it can also reduce some maternal death and also unsafe abortions that women, there is a research I read previously and I was like, if you restrict women to access abortion, you are pushing them to go unsafe.
Oh, yes.
So now if you compare, then rather than letting them to go unsafe, because if they go unsafe, still they come for post-abortion care treatment. And still the government is losing money because it has to treat post-abortion care. And to me, I think if the government sees that there is a need, of course, from the community, they can open up for all reasons, and it would really reduce.
I think Chris is actually challenging the women activists and several feminists out there, because they say it comes from the community.
Yeah.
It is time for the community to say, I think we are ready. Maybe it's time. Is it time, Giselle?
It's been time for a while.
For a while.
Yeah, a lot of women are out there talking about it. I'm very proud to how far we've come as women in pushing this idea, encouraging our government in amending that law and having access to safe abortion, not just for women who have dealt with incidents such as rape and incest, but to women, like you just mentioned, who are not ready to have kids. It should be fair, they should not be called name, and they should not be put in positions where they have to put their lives at risk. I think we're definitely talking about it, which is a start. The fact that we're even here having this discussion is progress. We definitely, among us, it all starts with word of mouth, talking about encouraging our peers, the people you work with, the people you live with, that you study with, to talk about it and challenge them, push them, make them understand the consequences that come with unsafe abortion. And I think over time we will challenge the system and hopefully make Rwanda a safer place for women.
Absolutely. Do you agree, Dr. Jean?
Yeah, I think
It's time as a doctor? Do you think it's time?
yeah, it's been a time, as she said. But again, when we come back to the evolution from 1977 up to today, we cannot always be on our side without looking to the changes that happened. So it's been time for that, but it's also time to appreciate the tremendous work that has been done, amending the roles, amending the orders up to today. So you can see the change. When you look at them, you can see the change immediately. So I think the work they have done is also tremendous, is very enormous. But again, there is still much work to be done to move forward. One being awareness, one being increasing trainings among future healthcare providers and healthcare providers who cannot do that. So I think training about services and bringing information at the front line are the things that we can now talk about and emphasize on. But again, as we keep on working the work we're doing today.
Absolutely.
Yeah, adding on what Jean has said, in training these health
doctors,
like these doctors, we should also increase centers that actually focus on this. Centers that are made to provide information in regards to contraceptive, in access to safe abortion. Do we also put in structures where you care for that person before having talking to a psychologist before you go through that, having a post-abortion care, dealing with what your body just went through. I think all those structures should be there over time.
Because I wanted to bring the issue of counseling, Chris. I mean, isn't this something that can be accorded to all women, be it maybe put on the law, counseling has to be done for women during or after preparing an abortion. Is this something that you can advocate for?
Yeah, it is even provided in the ministerial order. If you read it, you find that before a woman is, of course, given the service or attended to, she has to first go through counseling. Sometimes they go to seek the service when they are undecided. They are indecision. They don't have anything to do. They ask a doctor, I've been subjected to rape, but I don't know what to do. Then what a doctor will do is to counsel the woman, tell her all the advantages of the process she has to go through. And sometimes it's a woman to decide. So some have decided to keep the pregnancy. That's fine, because it's her right. And if they decide that now I have to go for a safe abortion, and then a doctor has now to have the informed consent from a woman, and she can sign the consent. So The counseling is provided, even before and even after. Yeah. And it becomes so particular when it is a child, of course, below the age of 18, because for them it really affects them so much because they are still young. Even making a decision is hard. And oftentimes you have seen where parents counsel them to keep the pregnancy. And at the end, they try to maneuver around. They go unsafe ways because the parents thought or thinks what they are telling to their children
is best for them.
Is right. But the child also sometimes, though the law doesn't really give her the power to decide, but she can also make a decision somehow.
Absolutely.
Yeah.
But this particular group of people we kind of forget every time. The women in rural areas, you know, they probably can't read, they probably can't write. What does the law stipulate for such cases? Like, you know, you can't read. You do not know your rights, but you're in the rural area, then, you know, things that happen to you along the way. What does the law, you know, cater for them? What does it say for them?
It's really hard for the law to specifically say those who can't read, the law is access the information this way. But if you look at human reproductive health law, it has provision that talks about awareness. And it puts responsibility to the government and partners, including HDI and others, that we have to conduct massive awareness. So these people, these women from rural areas, at least they can get information and access the service. And if you look at even how the law is designed and the ministerial order, you find that still these poor women from rural areas are the ones who are subjected to onerous conditions. Because if someone is empowered and has money and has maybe an insurance that can pay for everything, you'll never see her asking you for information. She's empowered. She knows where to go and what to do. So someone who doesn't have information, who is economically not stable, is the one who will go through such a process. And I believe that even what we are doing today, in other awareness campaigns, we are trying to reach those that are underserved so that they can have the information.
Absolutely. As we sum up, maybe, a way forward, you know, it is one thing to ask what the country can do for you, but what can you do for your country, you know? What would be your role as we sum up, moving forward? What, as Dr. Jean, as you move out today, what would you say you're going to do to help the community? Is it in terms of awareness? Is it in terms of advocacy? How are you going to ensure that we keep this talk going and, you know, maybe in the future help there?
Thank you for that. Normally, this is what I have been doing even with the favors of family planning, providing information to people, but also in my daily work, providing the services according to what we have today. So because if we keep on always the thinking of advocacy only without even profiting what we have today and use that, I don't think we are also responding to the question in a more accurate way. So if we start with what the law says today and use that, yes, of course, let the advocacy keep on going, but also don't waste the entire time on advocacy only without using even the opportunities that we have today. I will comment here on the opportunities that we have. We have the law determining offenses and penalties in general that also involves the article abortion. We have the ministerial order that gives enough details about how the procedures and everything is done. We have protocols, we have guidelines, we have ethics. So all of these things are opportunities for healthcare providers, but also for the society. And where you say the society that cannot, you know, have this information in most accurate and easy way, it's time for us activists and everyone to help them get that awareness. And all of these opportunities, when you put them together, they can change the status quo from one point to another one without waiting for the future outcomes of advocacy from today.
It's true. We've got to start now.
Yeah.
Giselle, moving forward, what's your role in all this?
I mean, I'm no doctor or lawyer, but in the, I guess, limited capacity that I have, my role is to encourage these discussions. This is where it starts, encouraging parents to talk about it with their children, encouraging my peers, my age mates to end that cycle of stigma and discrimination and making people understand that this is okay. It's okay, first of all, to even talk about it. It's not a lot of people are out there like actually having the guts, the courage to talk about abortion. But if even those who don't agree that it should be available, it's okay. Let's start there. Let me understand your opinion on it. But let's discuss and see the way forward that basically benefits everyone at hand.
Absolutely. Let's keep talking. Let's keep talking. Chris, over to you.
I think I'm privileged that at least on every day I meet cases where women and parents are calling. I would speak from the experience that, first of all, we need to sensitize healthcare providers to understand that the law is there. There are some who frankly tells me that we even don't know. The law is 1 year and a half old. We don't know if it exists.
That's true.
Then after sensitization, I believe then we need also to continue doing awareness for the right holders in the community who are underserved to get the information so that they can access the service. And also to see how we can harmonize the costs, the price. Because today most people is what they're asking. And you find the price depends upon the hospital facility. Here they tell them this, here they tell them this. And you have had cases where I have to personally talk with directors, those in charge of social affairs. Please, if she has insurance, can you please bill on insurance? And then they tell me, please, if you look at the list of those that have to be billed on, we don't see safe abortion service. And I believe it's high time that the responsible organs can sit and say, this is the take for this service, so that when women are not subjected to such administrative conditions that sometimes make them to withdraw the need.
Absolutely. Well, thank you very much, Chris, Giselle, Dr. Jean. Thank you very much for joining us today, and of course for keeping the conversation. But then again, let's keep the conversation going. Like we've said, let's keep the conversation going on social media and everywhere. And of course, special thanks to HDI in partnership with the Mbuto Foundation and the Ministry of Health and Bahoneza Project, of course, who partnered with RBA to have this conversation. See, the conversation has started. Do not be shy. Keep safe. My name is Fiona Mbabazi, and look at RTV.